When I was in 7th grade, my father had a heart attack, actually. My father, he was 42, had a heart attack. And I got kind of my first introduction to medicine and what it can do. He came out of that very well. He's still with us. He's still doing well. And so that really started my interest in becoming a doctor. I'll never forget that surgeon coming in. I thought he was a superhero, still do. Making that kind of change in someone's life is what made me really want to go into medicine. My interest in oncology really derived from several things. Oncology is a very scientifically driven specialty, and so we're always looking at new ways of treating. We're always looking at what causes cancer, how do we manage it, what causes resistance to treatments. The science behind it was very fascinating. But, ultimately, cancer patients are a special group of patients. They have a special set of challenges that they face, and kind of seeing patients go through that throughout my training in medical school and in residency sparked an interest in me in joining sort of that battle against this terrible disease. So invariably, when a patient comes in with a diagnosis of cancer, they're oftentimes very concerned and distressed. It's a scary thing and a scary diagnosis. And oftentimes they have some preconceived notions about what cancer might be or what the treatment might be like. They may have had a family member or a friend who had a tough time with their therapy or with their diagnosis, maybe even had passed from that disease. But I always tell them that there's no better time than now in the history of humankind to have a diagnosis of cancer. Our therapies have drastically improved and advanced. Treatment is substantially different even than it was a few years ago. Oftentimes now the course of a cancer patient through this journey is much better outcome, much less difficulties or problems around the treatment. And so, I always tell people, don't have a preconceived notion of what this is going to be or what's going to happen to you here. Oftentimes patients go through this cancer care treatment journey now with minimal impact on their lives. I always ask them to keep the hope alive and, keep focused on the path forward. So any treatment plan that is created for an individual patient is a combination of multiple things: the patient's diagnosis, where we're at in that patient's disease, and then the patient's wishes. I think the most important part of that is where a patient sits when they come in to see you. And I think I and my colleagues spend a lot of time getting to know a patient, what their desires are, what their challenges are, what their fears are. And those things are ultimately, I think, key to designing a plan for any one patient. It's a collaboration. The patient is at the center of everything. And they're the boss. I always tell them they're the boss. I work for you, and we're going to come to a decision on things together. That's definitely a key part of our treatment approach and our treatment planning. I think the great things about Siteman are, if it can be done in medicine, we can do it here. We have just a great resource for the patients throughout this region. You really will get the cutting-edge therapies. You will get world-class treatment. People here care deeply about patients and about what they're going through, the challenges they face. It's really a team effort. I don't know what the secret sauce is, but it works, and it's great to be here and be a part of it. So Siteman has grown substantially even since I've been here in 2013. We now have locations all over the city and into other states now. The benefit is that ultimately convenient care is oftentimes the best care. And if you have a place that's really close by to your home, the odds are we're going to have a specialist team there that is very skilled and adept at treating your cancer. The key part, the good part, is always when we see great outcomes, and I love it when we get to share good news with our patients, and that's why we all do this. Those moments that we all get excited about a good scan or a good response to treatment. Those are the things that we kind of live for as oncologists, and there's a great challenge in that journey for the patient, and more we have really great outcomes. That's the beauty of this specialty, is that we're making things better really every day for each patient. We're getting better treatments, we're getting better outcomes, and that's been amazing to see the changes that have already happened.